Okay, so बच्चे this gets us to our next topic in inflammation, that is the diseases associated with innate immunity. Now before I go to the diseases associated with innate immunity, एक बार have a look at this table again. This was the same thing that we saw in the previous session. We have a leukocyte receptor, a leukocyte receptor which is binding to an endothelial receptor. So which is the leukocyte receptor enrolling? It is sialyl Lewis X glycoprotein binding to selectins on endothelial cells. I need not even tell you, इसमें एक point और add कर लेते हैं. Selectins. Selectins, they are of three types. That is E-selectins, P-selectins and L-selectins. E-selectins, they are present on endothelial cells. E-selectins, they are present on endothelial cells. P-selectins, they are present on platelets. They are present on platelets and endothelial cells versus L-selectins which are present on leukocytes versus L-selectins which are present on leukocytes. Which selectin plays a major role in inflammation? कौन सा selectin plays a major role? E-selectin, L-selectin या P-selectin? What are selectins? Selectins, these are the endothelial receptors for rolling. Endothelial cells पे present है ना? So which selectin plays a major role in inflammation? That is E-selectins. E-selectins play a major role in inflammation. Which is the leukocyte receptor associated with rolling? Sialyl Lewis X glycoprotein. Which is the leukocyte receptor for adhesion? That is high affinity integrins. So we have two diseases associated with innate immunity here. First is LAD1, leukocyte adhesion defect 1, which is a defect in adhesion. And the next is LAD2, leukocyte adhesion defect 2, which is a defect in rolling. Opposite है, rolling occurs before adhesion. पहले rolling होती है फिर adhesion, but opposite है. LAD1 is a defect in adhesion, LAD2 is a defect in rolling. So let us start. Let us start with our next topic, that is diseases of innate immunity. Let us start with our next topic, that is diseases associated with inflammation or diseases of innate immunity. The first disease of innate immunity is LAD1, that is leukocyte adhesion defect. LAD1, that is leukocyte adhesion defect 1. LAD1, which is a defect in adhesion. Next point, leave 4-5 lines below this. Next, the next disease of innate immunity is LAD2, leukocyte adhesion defect 2, which is a defect in rolling. Both LAD1 and LAD2, both of these, they are autosomal recessive in nature. Both LAD1 and LAD2, they are autosomal recessive. Next point, let us first start with LAD2. Let us first start with LAD2. LAD2, which it is a defect in rolling. Why? It is a defect in rolling because of a defect in, which is the leukocyte receptor in rolling, because of a defect in sialyl Lewis X glycoprotein. Because of a defect in sialyl Lewis X glycoprotein. Sialyl Lewis X glycoprotein, this is a fucose containing ligand. इसके अंदर fucose होता है. It has fucose in it. It is a fucose containing ligand. Remember biochemistry, glucose, fucose, these are the carbohydrates. इसके अंदर fucose होता है. So in LAD2, the enzyme fucosyl transferase. In LAD2, the enzyme fucosyl transferase is deficient. So खुद सोचो, fucosyl transferase is deficient, as a result of which fucose is not able to enter into sialyl Lewis X glycoprotein, leading to a defect in rolling. Next point, which are the clinical features associated with the same? Which are the clinical features? Now, this is a defect in rolling. अगर rolling ठीक से नहीं हो रही, so obviously it is associated with increased risk of bacterial infections. ये तो बहुत ही obvious था. It was very, very obvious. It is associated with increased risk of bacterial infections. What you have to remember is, please put a star, it is also associated with mental retardation. It is also associated with mental retardation and Bombay phenotype. It is also associated with mental retardation, and Bombay phenotype. What is Bombay phenotype? Bombay phenotype, it is a rare blood group, was detected in Bombay. We'll do it in detail when we study blood banking. अभी नहीं, अभी हम लोगों ने सिर्फ 2 points देखे. LAD2, which is a defect in ruling, is associated with increased risk of bacterial infections and Bombay phenotype. What was the defect in LAD2? It was occurring due to a defect in enzyme fucosyl transferase. What was the defect? The defect was in the enzyme fucosyl transferase. This was LAD2. Next point. Next is LAD1. Next disease of innate immunity is LAD1. Next is LAD1. Leukocyte adhesion defect. Leukocyte adhesion defect 1. It is again autosomal recessive in nature. It is a defect in adhesion. Which is the leukocyte receptor for adhesion? Adhesins. Let me rephrase. Which is the leukocyte receptor for adhesion? High affinity integrins. So LAD1, this occurs because of a defect in. Beta 2 integrin. This occurs because of a defect in beta 2 integrin. It is a high affinity integrin. Clinically, it is again associated with increased risk of bacterial infections. Clinically, it is associated with increased risk. It is associated with increased risk of bacterial infections. देखो अगर एडिशन ठीक से नहीं हो रही तो risk of bacterial infections increase. It is associated with increased risk of bacterial infections. What you have to remember is, put a double star. It is also associated with delayed separation. It is also associated with delayed separation of umbilical cord stump. It is associated with delayed separation of umbilical cord stump. This is LAD1. So the minute anybody talks of LAD1, जब भी LAD1 की बात हो रही है, जब भी delayed separation of umbilical cord stump की बात हो रही है, only one disease should come to your mind, that is LAD1. Next point. This gets us to our next disease of innate immunity, which is this gets us to our next disease of innate immunity, that is CHS. This gets us to CHS, that is Shidiak-Higashi syndrome. CHS, that is Shidiak-Higashi syndrome. First point, it is a defect in phagolysosome formation. It is a defect in phagolysosome. Formation. Next point, what does this mean? देखो, phagocytosis हो गया है. Phagocytosis has occurred, but it is not able to bind with the lysosome. It is a defect in phagolysosome formation. Next point, it is also autosomal recessive in nature. So first 3 diseases of innate immunity, LAD1, LAD2, Shidiak-Higashi syndrome, they are autosomal recessive. Next point, occurring because of a defect in which gene is mutated? It occurs because of CHS1 gene mutations. Because of CHS1, easy to remember, Shidiak-Higashi syndrome, CHS1 gene mutation present on chromosome 1. Next point, put a star. Which is the most characteristic feature of the disease? Most characteristic feature of the disease. Phagocytosis has occurred, but it is not able to bind with the lysosome. So ये जो phagocytosed material है, this phagocytosed material, it is visible as giant granules in the neutrophil. This phagocytosed material is visible. It is visible as giant granules It is visible as giant granules in the neutrophil because it was not able to bind with the lysosome. So most characteristic feature is the presence of giant granules in the neutrophil versus the most common feature of the disease that is neutropenia. देखो, do not confuse most characteristic with most common feature. क्वेश्चन ठीक से आंख खोलकर पढ़ना है. मोस्ट करेक्टरिस्टिक फीचर इज जाइंट ग्रेन्यूल्स इन न्यूट्रोफिल्स. मोस्ट कॉमन फीचर, ये जो फेगोसाइटोस्ड मटेरियल है, इट इज टॉक्सिक टू द न्यूट्रोफिल, इट इज टॉक्सिक इन नेचर. सो मोस्ट कॉमन फीचर बीइंग neutropenia. Most common feature neutropenia. Because this was toxic, neutrophils are killed. Neutropenia. Next point, Shidia-Higashi syndrome. It is also associated with oculocutaneous albinism. It is associated with albinism. कौन सा subtype का? It is associated with oculocutaneous. Associated with oculocutaneous albinism. This was your next disease of innate immunity, that is CHS, Shidia-Higashi syndrome. Next point. This gets us to our next disease of innate immunity, that is CGD, chronic granulomatous disease. Which is this gets us to our next disease of innate immunity, that is CGD, chronic granulomatous disease. Chronic granulomatous disease or CGD. Chronic granulomatous disease, this is a defect in NADPH oxidase pathway. What was the role of NADPH oxidase? Remember, NADPH oxidase, it was responsible for formation of two free radicals. वो दो free radicals बना रहा था. कौन कौन से?